Hello to everybody that's keeping up to date with our current campaigns and projects. I know I'm trying hard to, and I'm the one doing them. I've got an update on the charter, both good and bad, mostly good though. I've just had an absolutely amazing meeting with, I can't remember their post, but an NHS lead in a health board in Scotland. I'm not going to be any more specific than that because I don't want to put any pressure on them. And it was fantastic, absolutely fantastic. They're very keen to implement. And we were just chatting really about the need for the charter. And what they said was that they're being not pressured. I guess the word, it's not pressured. It's not like do it, but they're receiving pressure from their local councillors to have a service for ME. They used to have one, but the member of staff left. And they are having difficulty filling the position. They want to have an ME and long COVID because of the overlaps, ME, long COVID, other chronic illnesses service. They've currently got over 200 people on a waiting list waiting for an ME type service. And they flagged to me that the lack of education means they cannot fill that position. Because they don't want just anyone. They want someone that knows something about ME. They want that person to be able to prescribe drugs for pain or maybe drugs for digestive issues. And, she agreed with me. There is no approved treatment for ME, but there are some things that can be prescribed for the symptoms of ME, which is correct. And she also said that she wants someone to be able to treat it holistically instead of putting someone on a waiting list for 6 months plus or sending them back to the GP to get a prescription. She wants to be able to do it in-house, which, all good, very positive. So she agreed with me. So in case you're kind of catching up with the need for a charter, at the moment, the current status quo is only around 10% of medics have ever received any kind of training on ME CFS. Around the world, in the UK, some people are becoming more empathetic, but that doesn't necessarily mean they've had training on ME. And that is why Stripe Lightbulb was created back in 2018. We knew that there was a knowledge gap. Now, although I am not medically trained, this is not created by a doctor. It is training from the patient perspective. It's including research of what is known about ME to enable HCPs, healthcare professionals, to learn about ME at a comprehensive grounding level. So that you learn the symptoms. ME is far, far, far more than just a list of symptoms, but we've got the diagnostic criteria. We've got videos of experts explaining why we've got cognitive impairment. We've got a holistic view about how the symptoms overlap and how you might want to holistically deal with those symptoms. And we've got the last section is when a patient presents in a hospital or a healthcare setting, these are the kinds of things they will be experiencing: sensory overload. Their symptoms might exacerbate while they're in the building and then 2 to 3 days later, all this kind of stuff. So although I'm not a doctor, I've got extensive patient experience, and as an ME campaigner of over a decade, the patient voice is centred in our training. We are the experts because there isn't virtually none medical knowledge. Anyway, so the person that I was speaking to literally half an hour ago agrees with me that the charter will help to fill the gap, because at the moment the gap between what patients experience and the gap between what is needed is huge. So the councils and the NHS Health Board that I was just talking to know that they need an ME, CFS, long COVID and other chronic illness clinic that can prescribe. Patients are in desperate need. And it's going to take years, if not decades, to educate enough members of the NHS to drastically improve the patient experience. So this is where the Charter comes in. We need the Charter to be implemented because all we're asking is kindness, dignity and respect, and for HCPs to refer to the NICE guidelines, because that is at the moment the only guidance that there are, even though they're not compulsory and mandatory. The Charter that goes in the middle here means that patients will experience a better hospital healthcare experience because of the Charter. And I was blown away by the enthusiasm of this person. She's going to escalate it to the next team up, so that you all know. What I did was health boards and ICBs and whatever else they're named around the country, because they're all called something different, all have very few customer-facing email addresses. So I literally had to spend a lot of time on Google trying to and the reason I emailed the Charter across is it is a document. I wanted to literally email it to them, give them a chance to read it and decide if they wanted to speak to me or not. That's why I chose email. It was a deliberate decision. So often the emails ended up going to the complaints section, the complaints manager or PALs. Sometimes it was contact us if you have ideas for improvements on how we can improve the ICB and provision. So that's the kind of email service that I was emailing. And at the top of the email, I literally said, please forward to the CEO, and I'd Googled that person's name, or relevant department. So it was up to the the initial person was told to forward it to the CEO. Then it was up to the CEO to decide who to cascade it down to. So some of the chats that I'm having are with medical directors of the ICB or the health board. Some have sent it to the MECFS service, which is weird because it's not for the the ME service. It's for the whole hospital to be rolled out. But some MECFS clinics have said, yeah, we want this in our hospitals, so we will help to roll it out. Fantastic. But as we know, there aren't MECFS services in every health board or ICB. So that's good. We are getting there. But I mean, this is going to take a couple of years to roll out. So I don't want anyone to expect it to be rolled out immediately, because that's simply not going to happen. I never thought that was going to happen. But yeah, I've now had meetings with medical directors or quality improvement directors who are looking for ways to improve customer experience on the hospital estate, which is exactly where the Charter sits. Some of you will have seen me flag my concerns. There is an ICB that sent the Charter to a mental health department. That was so it went to the complaints team, and then instead of sending it to the CEO, medical director, quality improvement person, or the MECFS clinic, they sent it to the mental health team. And because I'm an ME campaigner, because this immediately was a red flag, because I thought, if someone with ME sends a complaint to this ICB about their treatment, will they send that on to the mental health team, which is completely inappropriate? So anyway, so I flagged it. And I got a little bit of a defensive response, but hopefully it's been sent to the right place. But I've now been trying to get it into this ICB for months, unsuccessfully. So I might have to name and try and put a bit of pressure on them to at least get it in the right department. I don't know, we'll see, because ME is not a mental health condition. There may be overlaps with mental health stuff because of, PTSD, because of a result of the way we're treated, or they might have depression as a symptom of their ME, but ME itself is not a mental health condition. Do our training if you don't understand why I'm saying that. Anyway, so it's all it's good. But another thing is the delivery plan. The ME CFS delivery plan that's been worked on in government, Westminster, is the reason the charter was created in the first place. I read it, the interim one. Patients read it, and we got together to work out, hang on, what is missing from the delivery plan? This charter fills the gap while we wait for medics to get trained, for research, for people to understand what ME is and is not. And I've now had 3 ICBs come back to me and say, oh, well, thank you for your pet project, but we're going to wait for the delivery plan to be published. We're going to do what the delivery plan asks us to do, which is great, but they're still going to have gaps. And those gaps could be filled right now with a charter that's available right now. It's patient-centred, created by patients, created by a social enterprise, doesn't cost anything. Now, all these meetings that I've had with ICBs and health boards, one of the first things they ask is, how much does it cost? And to be clear, I'm going to clear this up. Yes, Stripey Lightbulb is a not-for-profit business. We sell training, but we also offer that training for free in certain circumstances if we know that people can't afford it, or if we know that there's no way this training is going to get done unless it's for free. There's leeway there. Yes, we are a business. That's probably why we haven't made any profit, but we've also made a heck of a social impact since 2018. We've made a business decision that for the charter to be implemented is completely free, because our community that we serve are desperate for changes. They're desperate for improvements in a hospital setting. So what we say is, the implementation of the charter is completely free. If you then decide, actually, we didn't know that Stripey Lightbulb offers training, we need to train our staff, even if it's not medical, but this is what ME is, this is what you need to be doing in a medical setting, this is how you can support people within a healthcare setting, do our training. But that's a side issue. The important thing with the charter is implementation. It's sitting there. It needs to be implemented and self-regulated by ICBs. Anyway, I just thought I'd do an update. It's been very, very well received once I get past that first hurdle of getting it to the right person. Because if no one's had any training on ME, they wouldn't necessarily know which department to send it to. But that's why I'm kind of aimed it at CEOs, medical directors and quality improvement people, because they're the people that would understand the need in theory. That's the update on the charter project. Thank you so much for all of your help, support, signposting. Some of you have emailed your ICBs or health boards. I decided to contact them direct because I think too few people were contacting ICBs and health boards, or they couldn't find the right email address for whatever reason. So I'm grateful for those of you that did. Obviously, I'm aware that many of you can't. And that's why after 3 months, I decided, right, I'm going to contact them myself. Slowly, catchy monkey. I will obviously let you know as and when there are improvements. But this morning was such a positive meeting. I think it was a bit of positive news that our community needs to hear. Very, very positive meeting. And this charter is for the whole of the UK. This morning's meeting was in Scotland via Teams. Anyway, lots of love to everybody, and I'll catch you later.